Good morning, my name is Marcus Ross. Your doctor ordered vancomycin, 1 gram per every 12 hours. Is that okay with you? Can you please verify your name and date of birth? Patient verifies name and date of birth. Do you have any current allergies? Patient doesn't have any allergies. I will educate patient about drug. Vancomycin is an antibiotic. It changes the permeability of the bacterial membrane, which eventually causes cell lysis and eventually cell wall death. You would check pre-assessment for patient white blood cell count to notify, so you could compare it with the white blood cell count at the end to make sure if the patient was if the medication was effective or not. Side effects is hypotension and hypokalemia or GI upset. It could cause C. diff. Then I would make sure the medication on the IV packaging is okay with, it matches the patient's name and the MAR. I would perform hand hygiene, don clean gloves. I would have a bag with my IV solution right here. I would take it out and lay it flat on the table, and I would take my packaging, open my packaging, and take my tubing out, trying to keep the tip sterile. You go ahead and go. I would take out the tip, put this in, plunge all the way down, make sure the roller clamp is in the off position. Hang it higher than the primary line. I'm given 200 milliliters with the drop factor of 15 drops divided by 60 minutes is 50 drops per minute. And then you will divide that again and get 12 and a half drops per 15 seconds or 13 drops per 15 seconds. So I would time this to where it drops 13 times within 15 seconds. And then I would
just pretend.
I would use an alcohol wipe to clean the port, and then I would insert into the port and open the tubing, and then make sure this drops 13 times within 15 seconds. And then you would assess the site of the IV or the INT lock for make sure for redness or swelling or any adverse effects, You would teach the patient that to notify provider if there are any worsened symptoms and to make sure they complete all of their antibiotic medication. You would go document it in the MAR, everything I've done here today. Then you ask the patient if there's anything you would need them to do for anything else they need help with. And that's it.